According to the CDC, in a published report, it states that the autism rate has increased, contradicting RFK Jr. on the cause. Tyrone Bowman live. According to an article written in the Washington Post, 1 in 31 8-year-olds had autism in the U.S. communities examined by the Centers for Disease Control and Prevention, a small increase from previous years, according to a report released Tuesday. The study comes as autism is attracting intense interest from President Donald Trump and Secretary of Health and Human Services Robert F. Kennedy Jr., who made the condition a priority for the new administration. Kennedy first shared the central finding of the biennial surveillance report in a cabinet meeting last week, during which he vowed to discover the causes of the condition and eliminate, quote, those exposures, end quote. For years, Kennedy has linked the rising prevalence of autism to vaccines, despite voluminous scientific research that has debunked that claim. In a statement reacting to the report Tuesday, Kennedy said the, quote, autism epidemic is running rampant, end quote. Autism is a spectrum of neurological conditions that affect how people communicate, behave, and interact with others. The Trump administration is launching a research program to investigate its causes, but a body of research already demonstrates the condition is primarily genetic and influenced by environmental factors that are still under investigation. Responding to Kennedy in the cabinet meeting, Trump described the 1 in 31 figure compared with the 1 in 36 in the previous report as a, quote, horrible statistic. He posted that there's something artificial out there that's doing this. Kennedy later blamed the rising autism prevalence on, quote, an environmental toxin, end quote. The CDC reports undercuts claims by Kennedy and Trump, instead attributing the recent increase to better screening. The report used 2022 data to examine cohorts of a 4-year-old and an 8-year-old children in 16 communities. It focused on the prevalence of autism among 8-year-olds, who are more likely to have been diagnosed by that age, using 4-year-old children as a measure of early detection. Quote, research has not demonstrated that living in certain communities puts children at greater risk for developing ASD, the report said, using the acronym for Autism Spectrum Disorders. Differences in the prevalence of children identified with ASD across communications might be due to differences in availability of services for early detection and evaluation and diagnostic practices. Areas with the highest autism rates also devoted resources to early detection, the report noted. You're watching Tyrone Bowman live. If you happen to like the report, if you like the program, consider subscribing to the channel. Thank you. The report examined communities of various sizes, including a portion of a south central Texas county and a swath of the Atlanta metropolitan area. The study was published in the CDC's weekly scientific journal, the Morbidity and Mortality Weekly Report. Spokesperson or spokespeople for HHS and the CDC did not immediately respond to requests for a comment on the report. A San Diego area community had the highest autism prevalence of any community in the study, with 1 in 9 8-year-olds diagnosed with the disorder. But California has a program that trains hundreds of pediatricians to screen children for autism early in their lives, as well as regional centers that provide evaluations and coordinate services for children with disabilities. Pennsylvania, where a suburban Philadelphia community had the second highest prevalence among 8-year-olds at 1 in 21, provides Medicaid to children with disabilities regardless of their parents' income, increasing the odds of early detection and treatment by providing easier access to health care. Puerto Rico children born in 2014 had below average autism rates, the report found, but children born after the territory launched a campaign to improve early detection had the second highest autism prevalence in their age group. Kennedy last week described the slight increase in overall autism prevalence as, quote, Astonishing, but researchers cautioned against making much of the change. The communities in the report are not a representative sample of the nation as a whole. The site examines also change over time, complicating comparisons. In his statement, Kennedy painted a dire picture of the toll of autism. Quote, the risk and cost of this crisis are 1,000 times more threatening to our country than COVID 19, Kennedy said. Autism is preventable and it is unforgivable that we have not yet identified the underlying causes, close quote. Leaders of the Autism Society, an educational and advocacy organization, called Kennedy's rhetoric misleading and stigmatizing. Quote, claiming that autism is preventable is not science based and places unnecessary blame on people, parents, and families, said Christopher Banks, president and chief executive of the organization. Autism is not a chronic disease nor a childhood disease. It is a lifelong developmental condition. It is not an epidemic, nor should it be compared to the COVID 19 pandemic, and using language like that perpetuates falsehoods, stigmas, and stereotypes, end quote. Peter Holtz, a pediatrician and author of a book that examines the genetic causes of autism, said what has been described as the rise of autism instead reflects an increase in awareness. Quote, the increase is overwhelmingly due to those broadening criteria and getting better at diagnosing, Holtz said in an interview before the report's release. It doesn't mean there is no genuine increase, and there are environmental factors, and they should be looked at. Air pollution, the use of certain medications, and older fathers are among the environmental factors researchers are studying. Dozens of studies across the globe conducted over decades have found no communication between vaccines and autism. Autism experts have expressed concern that the Trump administration is laying the groundwork to blame vaccines for the condition, noting HSS has hired a discredited researcher who propagated the false connection to study the topic. Trump mused last week that, quote, maybe a shot is responsible for arousing autism. And Kennedy dismissed the extensive research showing no connection, saying vaccines would be examined. You know, some of the stuff coming out of Washington is just totally preposterous. People just say stuff, make up stuff, throw stuff out in the air to appease themselves and others. And then when people get sick and families are in peril and they can't get the medication and stuff that they need because they listen to people who have no scientific data or anything else to back it up, I'm sorry that they listen. The report also contradicted Kennedy's assertion on Fox News last week that the report would show as many as 1 in 10 Black boys have autism. That is an outright lie. I don't believe anything coming from the racist and bigoted network because they are always saying disparaging things about black people 24 hours a day, 7 days a week, and 300 days, and 352 days out of the year. I don't believe anything they say over in that racist atmosphere. The CDC did not include prevalent data by both race and gender, but it did find 1 in 27 Black children and 1 in 20 boys had autism. So they say. Researchers have found no overall increase in autism among children of color. What do you mean children of color? We're not children of color. My people aren't people of color. I'm so tired of these people trying to marginalize us and name us and give us titles and things that do not apply to us. We're human beings just like everybody else. That's the bottom line. To my brothers and sisters, stop buying into the stereotypical narratives that these people are continuously perpetuating about us daily to propagandization. So a reversal from more than a decade ago when the condition was most prevalent in white children and in wealthier neighborhoods. The children of wealthy people have more health problems than most people who don't even have access to adequate health care. Why is that so? In 2020, autism became more common in 8-year-old children, they say, of color. You know what? I'm not going to even use that word no more. Damn that phrase. In 2020, autism became more common in 8-year-old children who are black than in white children. You know, because black folk always got to have the worst disease, the worst infections, the worst this, the worst that. And white people, they never get sick. They never have diseases. Yeah, whatever. So, and I don't believe too much coming out of the Washington Post because I know who it's owned by. Experts have attributed the changes to autism to better access to testing and screening. So the report's authors said deeper analysis of income and race suggests barriers still exist, which may explain why the study found low autism prevalence in primarily Hispanic Texas communities with below average median incomes. Garbage. I got to make sure, I comment here and there on things that I don't believe that are being trustworthy. I research everything. I'm an analytical reader. Never surrender. Never quit.